Hello, ladies and gentlemen, wherever you are, good morning, good afternoon, good evening, and welcome to our podcast number 5 on purchasing and inventory. The learning objectives for this podcast are, amongst others, to describe the steps required to implement an inventory control program, name factors to consider in procurement of supplies, develop a monitoring plan for the inventory system, and discuss the importance of documentation related to purchasing and inventory. A lot of the procurement issues we discussed in the previous podcast, so you can go back to that, but I will still tease them out in this podcast. Let us just be aware that the laboratory stocks and supplies provide the inputs for laboratory processes. And as sure as we know that garbage in, garbage out, so if you have poor quality supplies, you'll have poor quality results. The quality of supplies is dependent on choosing the right products and the right suppliers without having other considerations that have been discussing consistently in my podcasts. And a good inventory management system ensures uninterrupted service as supplies are available when required. This is extremely important, and the goal is set out during the budget preparation process early in the year. Whenever your year starts, whether it's the calendar year, January to December, so you'll start your procurement plan and budgeting around the last quarter of the previous year in October or September, or if your year starts in April or in June, as the case may be, then a few months before the beginning of the financial year, when the finances are approved, you should have drawn up your budget plan and your procurement plan. Now, as usual, let me lay down a scenario, and it goes like this. Your lab is asked to gear up for a potential flu epidemic. Your lab is asked to gear up for a potential flu epidemic. We all know about the flu epidemic that comes out annually. It's different for the Northern Hemisphere and the Southern Hemisphere, but let us assume that there's a potential flu epidemic that is coming up. The questions are, what purchasing and inventory factors do you need to consider in planning for this process? What purchasing and inventory factors do you need to consider in planning for this process? And what problems might you encounter in planning and implementation? What problems might you encounter in planning and implementation? The benefits of an inventory management program are numerous, and we just outline a few. Supplies and reagents will always be available when needed, and the quality of the supplies will be maintained, and there will be minimal wastage, and we will stay within the budget. Assuming that you've got a budget of a couple of $100,000 USD, then it's very difficult to come up in the operational year, second quarter, third quarter, and say you've run out of things. One, you not look as a very good manager. Two, there may be no surplus finances for you to be able to bridge that gap. So you want to ensure that during the budget process that you plan as well as possible. Inventory management has got some challenges, and some of these challenges is to balance between stock availability and expiration dates. I'm going to discuss this in a little detail because we know that not all of the supplies that we get in our organizations have got long expiry periods. Some have got very short expiry period. For example, sheep blood or horse blood, they've got an expiry of of about 1 month. So you cannot stock them. And the lifespan of supplies and reagents varies. For example, rapid immunoassay reagents expire between 3 to 8 weeks. API kits have got an expiry of between 4 to 12 months. Antisera between 1 to 4 years. Antibiotic Ds have got a slightly longer expiry date of shelf life of between 2 to 3 years. While ready to use culture media have got a shelf life of between 1 to 2 months. And dehydrated culture media has got a shelf life of between 3 to 5 years. So depending on the shelf life of the reagents and chemicals that you're using in your laboratory, then you will determine the number that you will have in stock against the expiry date. The key components for purchasing and inventory management are for the laboratory to, one, determine the vendor qualifications. What are the vendor qualifications that you like? Having stocks, delivering on time, and being able to offer alternates when they don't have what you need. This, again, I reiterate, is best done during the planning stages, early towards the end of the previous operational year. Then to have a purchase contract in place and determine the delivery timelines. Are these going to be delivered every month, 2 months, 3 months, 4 months, 6 months, or annually? What I found working well for my laboratory is some of the non-expiry items like lab coats, like paper towels, or with very long expiry shelf life, like dehydrated culture media. These work well for me when they're delivered once annually, so that we have supplies for the whole year. You can also ensure that you have a good relationship with other laboratories for you to be able to borrow and lend. This happens a lot with labs, so don't shy away from borrowing or from lending, but you want to ensure that you keep a good inventory of what is owed you and what you owe, and give back in time. Inspect the supplies, test the supplies, and ensure that you handle them well. Have adequate storage space, and assess the conditions of the supplies once you receive them, and how to maintain them during use. How much of these supplies do you have at the testing bench, for example? You don't want to order 50 items and then all of them are available at the workbench at the same time. No, there has to be a way of maintaining this. As I said previously, I'm not a very big fan of logbooks and paper. However, if you don't have a bespoke or off-the-shelf inventory system, you can use logbooks where you indicate what you have received, the expiry date, and also ensure that you rotate stock for the first in, first out, so that you use the ones that you have in store, and then the ones that you have received afresh go back to the back of the shelf. And post use and tracking, meaning that the end user at the workbench would request, what I recommend is to request on a weekly basis, and then these go to the lab administrator, who can then get these things from the main store. So you can have a mini store at the lab space, and then the main store. I found that having a mini store where it is replenished quarterly from the main store works very well. But you have to determine in your own space and in your own organization what works well for you. So you need to establish a system to qualify and select vendors. Like I said before, you have to define the criteria for supplies and services to be purchased, use information from other laboratories, and evaluate before purchase and after receipt. This is where your experience and skills as the manager or the director come into play from your previous job positions, knowing which supplies worked well and which supplies have not worked well, and what you need against either the test menu that you have, or the various scientific programs that are coming on board, or health issues that are coming on board into your laboratory. Then evaluate before purchase and after receipt. In purchasing, we have got several considerations. Main one of them is to understand government or organizational requirements. What are the requirements? Say, for example, you are working in a research institution. The research institution will have collaborative program with either partners or donors, and who they would have requirements on how to go about purchasing. Government, the same thing. Most of them that you cannot single source, and if you have to single source, you have to write a justification and indicate why you are single sourcing from that. If you remember in my introduction, I indicated that there should not be any other considerations during the purchasing process, because this is where you come under scrutiny. Now, negotiate the prices so that you get value for your money. And then once you've drawn up the contract, you review the contract. Better to give it to your legal department to also review the legal aspects. Important that you let your legal department and your operations department to sign off these contracts. You do not have to sign off. You just have to indicate that you're satisfied as far as the lab is concerned, that the contract is good, and then they will determine the legalese to be put in the document. Also determine the payment mechanisms. Again, this you can leave to the finance department, and also assure reliable availability and delivery. This is your job. This is my job. That when the things that we require are available and they'll be delivered when we need them. So the vendor, whether they are from the North Pole or the South Pole or from the East or the West or Central, that they have gone through all the country requirements and that they will be able to deliver all of the items that they've said they'll be able to deliver on time. So now we have gone through the purchasing, we have gone through the contract, we have signed the contract, and we have determined the frequency of the shipment of the purchases to the lab. So we must be able to control this inventory. As I say that, some of the bulk items with the longer expiry period will be delivered once a year. They'll be stored in the main store. So how do you control this inventory from between the main store, the mini store, and the end user at the testing bench? So there are several things that I want to go into in detail. Some of these are, you must assign responsibility, you analyze the needs, establish minimum stock needs, develop forms and logs, establish system for receiving and storing the inventory, and maintain inventory system in all storage areas, whether it's the main store, the mini store, or at the test bench. So how do we analyze these needs? We conduct an analysis of supply and reagent needs by, one, listing all tests in the laboratory. This comes from the test menu. And also taking into consideration, you have spoken with the medical director, you have spoken with the research scientists on what their needs for this coming budget year would be. From that, you'd have determined the tests that would be needed, and from the test, you'll work out what the reagents are, and then make a plan of that. Identify all the supplies that you needed for each test. For example, if it is going to use a specific anti-sera, how many tests, 2,000 tests or 3,000 tests, and then I always recommend that you have a buffer on top of the number, so the buffer would be 10%. If you have a big buffer, then you'll be running into a lot of waste of supplies that have not been used. And also, you can analyze the needs by using available information to estimate the usage, like I indicated. The information either from the scientific work or from the medical director, I will discuss this in slightly more detail. Now, when you're analyzing the needs, there are some information that are required. Mainly is the item description. So you have determined what the tests are going to be and what the reagents would be. The item, this is extremely important because all these items have got a code and got a lot number. So the code is extremely important to be able to differentiate from one manufacturer to the another, and even from the same manufacturer. Just missing one letter or number will give you a totally different item. So you want to make sure that you have it correctly. What is the unit of count? Is it liters? Is it gallons? Is it boxes? Whatever it is, you get it correctly. And what is your usage per month? This is quantification. How much are you going to use per period of time? Daily, weekly, monthly, and annually. What is the priority level? It is extremely important to know that some of the items that you've got have to be shipped together, because the vendor will not know, may not know, or may not care that item 1 comes together with item 10 and item 275. Those items must come together because they make up the test. For example, if you get API 20E kits, but you don't get the ampules, or you don't get night 1, night 2, and GEMS reagent, you will not be able to use the kit. So all of those must come together, and it is your job to ensure that you have described it in a way that it is obvious on how you want them to come. And the order lead time and delivery time, this is extremely important. You know from the vendor, wherever the vendor is, you would have discussed this during the drawing of the contract. What is the lead time required? Some of the items require a lead time of 2 weeks or 1 month. Some of them require a lead time of 6 months. Because some of them, for example, which are being made as specialized product, for example, TAC cards or immunoassay reagents are made specially for you, then you have to ensure that you have an extremely long lead time. This is where planning for the whole year comes into play. So in detail, what is quantification? Quantification is a process for calculating how much is required of any particular item for a given period of time. How many packets, how many liters, how many microliters do you need for a given period of time? This time could be daily, then weekly, then monthly, then quarterly, semi-annually, and annually. So when do we this quantification? We do it as a part of our annual planning, as I indicated, that if, for example, your financial year starts on July 1, then you need to start this planning in January, because it takes a long time for the final list to come together. We also do quantification when implementing a new health program and also in preparation for a potential or a newly identified epidemic or outbreak. There are several ways of doing this quantification. One of them could be consumption-based, which is based on the actual usage, but this must take into account several things: the health supplies actually used, the wastage, expired or spoiled supplies. I indicated that you can have a buffer of 10%, but you find some people have seen where people use even a buffer of 50%. This is total wastage, and you're actually burning your money. It's like taking your money, your dollars, your pound sterling, your Kenya shilling, your whatever shilling money you're using, and striking a light to it and burning it off. Supplies out of stock for more than 15 days during any time of the year. Stock out time has to be either non-existent or as short as possible. This you would have determined from historical data, or if you're a new place, then determining from your test menu. And your test menu, as I've indicated many times, are derived either from the hospital or from the research institution where you are. The second quantification method is morbidity-based, and which is based on the actual number of episodes of a disease, and this must take into account the population size, the disease incidence, accuracy of morbidity data, and treatment guidelines. For example, if it's malaria, then you look at the population size, for example, say 10 million people in that area. The disease incidence could be 20%, and the accuracy of the morbidity data, meaning that there has to be surveillance data and other data that has been accurately recorded over time for you to be able to use that data accurately. And also the treatment guidelines is what you're ordering being used as a first test or a confirmatory test or a tiebreaker. If the treatment guidelines require that you do a first test, then you do a confirmatory test, then you do a tiebreaker, it means then you have to order your supplies accordingly. The inventory control, it's important, as I indicated, that you have correct documentation, because if you don't have data and documentation, then you wouldn't know what you have received, you wouldn't know what you have used, and you wouldn't know what you have remaining. You have to maintain records on the date received, the lot number. I indicated this very clearly because sometimes there is failure of the kits or the reagents, and then you can get back to the vendor using that lot number for replacement purposes. Pass or fail acceptance criteria that you would have set out on a standard operating procedure. What do you consider the reagent has passed or failed for you to be able to use it? And the date placed in service or disposition. Then the initials of the person who is doing this. This may be useful to keep records in the stockroom, also at the bench and the mini store. Now, for those who don't have, as I indicated earlier, an electronic system for stock control, you can use a logbook. And then there has to be a way of controlling that logbook so that pages are not torn off or not lost, and a proper way of either crossing things or adding things or taking things out, which are clearly outlined in the SOP. So the logbook would include name and signature, date of receipt, quantity, date of expiry, minimum stock levels, and minimum stock balance. The other information that could be there used is the shelf number and the destination. Is the destination the main store, the mini store, or the test bench? You must inspect new orders at time of delivery. Things will get delivered at night. Things will get delivered in the weekend. So please don't say, you as a team lead, that you're not available on Saturdays or Sundays. If you're not available, then your designee must be there to receive and verify the contents of the shipment, check the integrity, record the date each item has been received, record the expiration date, store new shipment behind existing shipment as indicated, fast in, fast out, and create or update records. There'll be the shipment document which you need to sign to go back to the vendor as proof of delivery document. That would initiate the payment from the organization to the vendor. So that is why this is extremely important. A second thing is that some of the items that will be received would require either freezing or refrigeration conditions, and so this must be taken out immediately. I usually recommend strongly that for these kinds of materials which require freezing, which would come either in dry ice or ice packs, should have the temperature control gadgets in them, so that you are able to see clearly, download and see the temperature, because sometimes materials arrive at the airports and they take a long while before they are cleared to come to your laboratory. And it is the responsibility of the vendor to ensure that if restocking of dry ice is required or ice packs need to be changed, that this is done. You will see this history when you download the data logger. So this is extremely important that you do it immediately upon the arrival of the supplies. That's why if the supplies arrive, ideally they should arrive from 8 o'clock to 5 o'clock, Monday through Friday. But as I said, that things happen and they can arrive at night or during the weekends or public holidays. So once you have verified the foregoing and you have determined what goes into the main store, in the first instance, some of these need to go to the main store. But if you don't have, for example, ultra low freezer or fridge in the main store, and these need to go to the main lab immediately, then together with the store's manager, you indicate what you have received and that it has been taken to the freezers in the lab or in the freezer room. So the storeroom must be clean, must be organized. This goes without saying. It must be lockable. I don't need to say more on that. Well ventilated, no direct sunlight, good sturdy shelving and items within reach, and safety precautions available. Ensure that infestation by rats, insects, and other vermin is controlled and it is not there at all. So you must follow the safety precautions on the shelving. Make sure that the shelvings are tied well, the shelves are tied well to the wall, and there must be available a short ladder and a tall ladder as required or as needed, and ensure that all safety precautions are followed. Now, we lose products because we don't remember where they are, where we place them in the main store or in the mini store. So in order to not to lose a product, we must ensure that the shelves are labeled. Whatever labeling system that you are using, ensure that it is labeled, and that at a glance you are able to know where a particular product is. This saves time and also systemizes the storage space. Also, the same thing goes into the freezer room or the cold room or refrigerators and freezers, and the shelves must be labeled accordingly. On the door of the freezers or refrigerators, you must have a map of what is inside there. Use clearly visible dating labels so that people should not struggle to see them. Take at the end of this podcast, take a bottle of your favorite cold drink and try to look at the expiry date. It's not very easy. Your cold drink may be black, and then the expiry date is either at the bottom of the container or at the neck just below the maximum liquid level. This is done on purpose so that they can either sell you expired products or nearly expired products. So check the expiry and rewrite it using a Sharpie marker pen in large legible writing, and also the date that it has been opened. Continuous monitoring of inventory is extremely important, and as always, if you leave it to everybody, then nobody will do it. So to ensure that is not done, you must assign responsibility. My mantra is that people don't like to be managed. Unfortunately, they have to be managed for them to be able to do what they need to do. So assign responsibility and ensure that this responsibility has been carried out according to your quality management plan. Also maintain an inventory system in all storage areas and update the records as required. I'm a big fan of computerized stock management. Makes things easy. Apart from reading my daily newspaper and my book using hard copies, everything else I would prefer using computerized systems, and it's got advantages and disadvantages. The advantages, some of these are the exact current state of stock and product classification can be very easy to see at a glance, because then you can be able to pivot to whatever you want and see at a glance what you have, what you don't have, the date received, the number remaining, the expiration dates, all of that you can get at a glance and print it out and play around with the data the way you want. It makes inventory tasks easier. The main drawbacks are that an on-site computer is needed and it requires trained staff, and also dedicated internet facilities are required to do that. But the advantages are much more than the disadvantages. Now, in summary, is that a well-managed lab will have a system for inventory maintenance and purchasing. The system will require planning and monitoring, analyzing needs, developing forms and procedures, and maintaining an inventory. The lab will maintain an inventory system for all reagents and supplies used in the laboratory. My experience is that if you don't do this well, then, like I always say, on a Friday afternoon or on a Thursday morning, the technician, the technologist, the scientist will come and tell you, hey, we have run out of this kit. And the lead time required to get that kit is 4 months. What do you do? A very good example is when you're using sheep blood or horse blood. And then they suddenly say, oh, we only have 5 mLs of sheep blood remaining. And the next shipment is 4 weeks away. So it's easy to say, use human blood. This is where we go wrong. And even though you're going to write an incident report and do investigation, but it is things that should not be encouraged and should not be happening in an accredited or a well-run facility. So the key messages for this podcast are that managing inventory results in increased lab efficiency and effectiveness, assurance that patient or clinical needs are met, and products available when needed. You don't want to be the person, the patient, the study participant. When you are due for a test in the laboratory, you're told, come tomorrow or come next week, or we don't know when our supplies will be in, and you don't get the test that you need because um, more than 70-80% of medical decisions by clinicians are determined by the laboratory results. So we must ensure that these results are, the tests are done, results are available as and when needed. Thank you very much, and I welcome your questions, your comments, your concerns, as usual, through my email, joundo664@gmail.com. Come to my YouTube channel, and let's discuss there. I'm very obliged with the comments that I've been receiving, and that really this has been helping the wider scientific community. Thank you, and see you next week.